Dr. Neusner, why is a plastic surgeon doing my hand procedure?
Oh, I get asked that almost every day. Hand surgery is actually one of the core disciplines of plastic surgery training, at least in the United States. So all board certified plastic surgeons know how to do hand surgery. That being said, most of them have forgotten, but I actually really like hand surgery. I did fellowship training in hand surgery. In fellowship, we learn everything from fingertips up to the elbow pretty much. The most common things they'll do are carpal tunnel surgery, trigger finger release, the Quervain's tendonitis, wrist arthritis, taking care of injuries like tendon lacerations, take care of tennis elbow, golfer's elbow. So orthopedic surgeons and plastic surgeons both do the same training when it comes to the actual kind of nuts and bolts of hand surgery. And I like to think the benefit of coming to a plastic surgeon is, first of all, I've had a lot of training and focus on meticulous tissue handling, being really delicate with both the small structures in the hand and then of course the skin. So a focus on doing a really elegant, beautiful skin closure no matter where we're operating, even if it's just a carpal tunnels release or fixing a cut on the hand. That's a focus of mine in all of my surgeries, and it carries into hand surgery as well.